The Ministry of Health begins administration of the second dose Sputnik V vaccine this morning. We spoke with the Honorable Minister of Health, Dr. Frank Anthony, about this. The minister also addressed some up and running vaccination sites in Region 4, and of course, some hotspots are now engaging the attention of the COVID-19 task force. Minister Anthony, thank you so much for joining us today.
Thank you very much for having me on the program.
Yes, sir. I know today is a busy morning. It's the rollout of the second dose, and a lot of persons have been anticipating that. I wanted to ask you, what other avenues government exploring to procure more vaccines for Guyana?
Well, first of all, I see there's a noticeable increase in the numbers of persons coming to our vaccination site, and I'm happy for that. I guess most people were awaiting their second dose Sputnik. So we have those in country, but I just want to remind people that we want to give those whose second dose is becoming due to get their vaccines first, which means that persons who would have received their first dose Sputnik in April are now going to be due for their second dose. We want those persons to have their second dose now. And therefore, the others who got their first dose later can hold on a little bit, and they would get their second dose in due course. So I just want to make that appeal. But as you know, we have 3 vaccines that we've been working with in Guyana, and that is the AstraZeneca vaccine. Those AstraZeneca vaccine, we have seen very good uptake of them. We have given out all the first dose for the AstraZeneca vaccine, and what we have remaining now is second dose. So we have kept back enough vaccines for people to receive their second dose. Now, according to our calculations, a lot of people now are due for their second dose, and we want to appeal to people who would have received their first dose AstraZeneca to come to any one of the vaccination sites so that they can get their second dose AstraZeneca vaccine. We also want persons who would like to have whether first or second dose Sinopharm. Those vaccines are now available and they have been distributed to the various sites. And of course, we have the Sputnik V vaccine, and we have now both first and second dose. So those persons who were hesitant in taking the first dose, I would urge them to take the first dose, because we have second dose now that is available. In terms of the other sources of vaccines, as you know, the government has bought vaccines, so those are, we are going to continue to receive the vaccines that we have bought from the UAE. We have also been working with COVAX to get vaccines. Guyana is one of those AMC countries, and COVAX has promised us that they would be sending additional vaccines to Guyana sometime between now, meaning July and September. So anytime between July and September, we are expecting another shipment of COVAX's vaccine. We have also paid for the Johnson & Johnson vaccine, and this is an arrangement that we have had with the African Union. So we were required to pay for these vaccines, which we did, and the latest information that we have is that they'll be able to ship those vaccines to us in August. So as we get the specific dates, we'll make those known to the general public.
All right, thank you, sir. I wanted to ask you for an update on the vaccination sites. How many additional are now up and running?
So we have on an average day, we'll have about 100 sites that are working. In different regions, it varies. Sometimes they have more, sometimes they have less. But the staff in the various regions, one of the things that they have been doing is if they have exhausted the vaccination in a particular area, then they're doing two things. One, they're either moving the sites to other areas, or they're now doing a form of mobile vaccination. So they go into a village and they literally go house to house trying to get people to take the vaccines. So that is ongoing in a number of communities, and we are getting a mixed reaction because some people are still hesitant. We are working with a number of partners and groups to try to influence people to get the vaccine, and hopefully the numbers would start going up once we can reach more people.
All right. One other topic I wanted you to address: hotspot areas. Are we seeing an increase in hotspot areas, and how are we treating with them?
So currently we have 1,321 active cases as of today. So if you've been looking at the numbers over the last couple of weeks, we would have seen a relative decline in the number of active cases. Over the last 24 hours, we've had 56 new cases. And as you know, we would monitor people for approximately 10 days or so. And once the two last days, they haven't shown any signs or symptoms, then we are able to discharge them. So using this WHO criteria, we have been able to discharge people. Right now, we have seen a number of areas where relatively high numbers. And so in Region 3, we are monitoring Sisters Village, where we have approximately 20 cases. Region 4, the area that we are monitoring is in Sophia, where we have about 20 cases. Region 6, New Amsterdam, continues to be a little bit problematic. And we currently have in New Amsterdam 32 cases. In Region 9, over the last 3 weeks or so, we have seen a surge in cases. And right now we have 39 cases in St. Ignatius, 33 cases in Lethem, another 19 cases in Tapachinga. And in Region 10, we have at Wisma and Mabura 17 cases each. So these basically are the places where we have relatively high numbers, and we continue to monitor. We continue to get the persons who have tested positive to isolate, and hopefully these measures would help to reduce the spread of the infection.
All right, thank you. On that note, could I just ask you for the vaccination numbers so far? And you give that to us daily.
Yeah, so as of yesterday, we have had 239,877 persons who have received their first dose vaccine. This approximates about 79.3% of our adult population. In terms of second dose, we have 120,914 persons who have received their second dose, and this approximates to about 24.8% of our population.
Thank you so much. My last question for you is the Mythbuster. If I receive the COVID-19 vaccine, I'm at a greater risk to become sick from another illness, yes or no?
No, you're not at greater risk of becoming sick from another illness. When you receive a vaccine, people react differently. So you can have some side effects to the vaccine. These would occur within a 24 to 48-hour period. Some people would experience maybe a little pain at the site of the injections. Others would have fever. Some people would have a little bit of weakness and so forth. But all these signs or symptoms would subside within a 24 to 48-hour period. In extremely rare cases, you can have maybe an anaphylactic reaction. And in checking for those, that is why after someone would have received a shot of the injection, that we will observe them for at least 15 minutes. So if you had an injection and you would react badly to this injection, then that would happen within the first 15 minutes or so. So that's why we ask people to stay back and we observe them for that 15 minutes period. Outside of that, these vaccines are made especially to protect people from different diseases. In Guyana, apart from vaccinating people for COVID, we have had very long experience in terms of vaccination. And Guyana has one of the most robust vaccination programs in the world. We have been giving vaccines for children, and we do different types of vaccines. In fact, we give out about 18 different types of what is called antigens. And generally, the uptake of these vaccines has been extremely good. So parents normally would bring their children to be vaccinated against these childhood illnesses. Our coverage for these vaccines range from 90% to 98, 99% of the children population. So we have had very good vaccination rate, and we are hoping that by educating and talking to people that we'll see similar coverage for the COVID-19 vaccine. So we need to work on it, but again, vaccines prevent disease from occurring. It doesn't give you a disease.
Minister Anthony, thank you so much for speaking with us. Well, that's it for today's COVID-19 update. Of course, we just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.